Hi, welcome back to the podcast. I'm Dr. Lindsay Renzullo.
I'm Dr. Christopher Vernaleken. Today we have a guest from one of our East Region hospitals, which is in Virginia. It's called the Oncology Service, and that's Dr. Ira Gordon, who is the medical director and radiation oncologist. And we also have Dr. Bridget Stewart, who's a medical oncology resident. So welcome, guys.
Thank you.
Thank you.
So did you guys want to, why don't you start with introducing yourselves? You want to start, Ira?
Sure, thanks. I'm Ira Gordon, and as you said, I'm a radiation oncologist. So I provide consultations and radiation care to our patients primarily out of our Springfield office, and I'm the medical director of our group of 3 practices.
Yeah, great. And Bridget?
I'm Bridget Stewart, and I am a medical oncology resident and came by oncology by way of originally being an emergency doctor and then actually working in oncology as a hospitalist for quite a few years. And recently, with help from Ethos and our team here in Virginia, I'm officially doing a residency in medical oncology.
I don't think we've had it. Lindsay, do you remember, have we had any interns or residents, any house officers at any point on the podcast yet?
No, I don't
She
think
might
we
be
have.
the
This is
first.
actually
It's
super
awesome.
exciting.
She'll
Yeah.
definitely be the best.
Oh, that's
Absolutely.
very nice. That's very nice. So I think when we started this episode off, one of the things that we talked about as a group was just oncology. And I think a lot of people know the word oncology means cancer, but not everybody does. Like not all of our clients do. When we start talking about, cancer and oncology, I think that, a lot of clients are a little bit confused about all the different options. And so you both had sort of stated, you're in radiation oncology, medical oncology, maybe you can just kind of let our listeners know a little bit of a difference between the two.
Do you want to talk, Ira?
Sure. So, oncology is a specialty that involves all aspects of care of cancer in animals. And so it's actually not limited to just chemotherapy and radiation therapy, but also includes surgery and medical management of cancer as well. And so as oncologists, we are really the people that have the most expertise when it comes to the care of animals with cancer. And my specific area of practice and focus involves the delivery of radiation to those patients, whereas our medical oncology team are the ones that will prescribe and deliver chemotherapy to them.
And I think I'm going to jump on the team aspect of that. It's really a group that works together with a lot of other services. As Ira mentioned, that the surgery team, and we have surgical oncologists as well. That's an important aspect of the care. We coordinate very heavily with the primary care doctor as well as other specialists. So it's really a team effort managing cancer in pets.
Yeah, I think that's always the thing that maybe Lindsay and I deal with a lot with, especially the general practice aspect, is that I'm often really surprised at just the lack of people really knowing what cancer is, right? It's sort of like, well, you need a team because each cancer is a different kind of cancer, right? And each cancer, even of one particular organ, you can have 4 or 5 different types of cancer, or even more, right? And some of them are going to respond to a particular mode more than others. Some cancers are going to be amenable to surgical removal, which is why you have the surgical oncologists. Some are only going to be more responsive to radiation. Some are going to be more to medical. And so it's like that team approach is amazing. My own dog had cancer when I was in vet school. He had thyroid carcinoma. And so it was a combination approach of radiation therapy and medical oncology because that specific type of tumor required that, right?
Yeah.
But I always get those clients are like, could it be cancer? I'm like, yes, it always could be because it could be any. That's not just one disease, basically.
Mm-hmm.
Yeah. And I think that a lot of times when we see it in the general practice, we are getting clients that, we are early on the course of the diagnosis, starting to figure out what might be going on. And, I always let owners know, after we get sort of some glimmer of they're seeing some neoplastic cells or they're concerned about different type of cancer that, this is the time where oncology is so amazing to be able to have that as a resource because you guys do this day in and day out. This is your specialty. And so being able to have somebody that knows exactly the best diagnostic approach to sort of get a great sample and how to sort of treat it and follow up with it is so important.
Yeah, I think you guys and the general practitioners really have oftentimes the hardest job, which is starting with a problem and running the test to determine the cause of that problem. And when that problem is a cancerous problem, then communicating that information to the pet owner, which oftentimes they may not even be expecting. And we sort of have oftentimes the benefit of seeing that patient after a pet owner has already had a little bit of time to process that news that their pet has been diagnosed with a tumor and has already kind of moved their mindset a little bit towards, and what can we do to treat that
Yep.
problem?
So yeah, so we have, we'll have a case, and many pet owners that are listening to this have been in this situation where maybe we have a definitive diagnosis. We've sent a biopsy out, right? We have the cellular diagnosis of the cancer, or maybe we have just a really strong suspicion, or we have equivocal test results. So we'll send you the case, whatever status it's at, right?
Right.
So tell us, Bridget, tell us what you would do now. You're going to take this pet that you have some bits of information, and what are your steps as an oncologist to, figure out a plan for that pet?
Yeah. Prior to the pandemic, I would say most of our cases were already diagnosed. It is interesting. That's been a change in terms of, I think, just the overwhelming need for pet care right now.
Oh, that's
That we
interesting.
are seeing more patients with a suspicion rather than a true diagnosis. And there's a lot of things that we can do. We often talk about imaging, which can be things like X-rays or ultrasounds, like a sonogram that they do in pregnant women. But more and more, we often have more advanced imaging available to us, like CT or CAT scans, MRIs, and that can often really help. But we also do some of the basic diagnostics, aspirates, sometimes small biopsies. And sometimes there are really more complicated tests that can take a long time to sometimes explain, but where we're actually looking at the cellular features or markers on the cell to try to figure out exactly what this is. And it, as you mentioned, Krista, depends on the type of tumor, how complicated sometimes it can be to get the diagnosis. But we do have all those tools available to us, and just figuring out exactly where to start, sometimes is the biggest discussion point for owners. But usually, with some degree of effort, some are easier than others, we'll get the answer.
Mhm.
Yeah, that's
And then
really
there's,
well
go
said,
ahead.
Bridget. That's really well said, Bridget. I think I sort of think of those tests as being we're really trying to do two things. We want to figure out where the disease is, which in cancer we call staging. Trying to evaluate, is there just a single lesion that's been diagnosed as a tumor, or is it potentially involving multiple places in the body, which we oftentimes refer to as metastasis. And then we need to figure out what it is. And so that involves figuring out what the cell type is, and sometimes using more advanced molecular techniques to actually figure out what some of the more detailed cellular features of the tumor are.
And I think that a lot of times when we have clients that we are either suspicious or we have a diagnosis of cancer, I and a lot of the vets will try to urge them to go to an oncologist. And there is a preconceived notion that I do think that on our front, on the general practice front, we try to sort of diminish, where they have this preconceived notion of what oncology is. And just because they're extrapolating that from humans, and when they see humans that they know of are undergoing chemotherapy or radiation, they see, these radiation side effects or these chemotherapy side effects that seem so undesirable for their dog or their cat, that they're almost reluctant to go ahead with it. And then we really try to urge them and explain to them that it honestly isn't the case, right, guys? I mean, it's not always the case that these patients are getting these types of side effects.
Yeah, I wish we could sometimes get our pet owners in on some of these podcasts, because I agree. A lot of people come in and they're really fearful, right? They're fearful because they've got a diagnosis of cancer, and then they're fearful what the treatments might mean. But thankfully, our pets do a bit better, and in some ways a lot better. They don't have the anticipatory nausea that's a big problem in humans receiving chemotherapy. So that already we're starting often at an easier place. We also just don't see as much of the nausea, the vomiting, diarrhea that people get. And so again, that makes our job easier. And I think once we get that information out there, a lot more people, on my side, are willing to do chemotherapy. We also have more and more options that are not traditional chemotherapy. And that's a lot of where things are moving in human oncology as well. But we have a lot more of these targeted inhibitors, which still can have side effects, but are not the traditional chemotherapy. So less of that even concern with the overt or acute vomiting and diarrhea. Ira. Turn it over to
Yeah,
you
I
for
think
radiation.
a really common thing that we'll hear from pet owners, especially initially, is this notion of I'm just not sure if I want to put my pet through,
Right.
these treatments because of my concern for these sorts of side effects that I associate with cancer therapy. And we really have oftentimes a piece of education to go through related to our goals in veterinary oncology and the fact that our goals are really consistent with trying to maintain and improve pet quality of life through the course of therapy and of course beyond as well. We really don't consider it to be acceptable toxicity when pets are not feeling well for days, or if they need to be hospitalized because of any type of toxicity. Nobody wants that for their pet,
Right.
and we don't consider that to be acceptable. I can't say that it never happens, but it is certainly the exception more than the rule, and making sure that we're appropriately weighing the risks of side effects versus the potential for benefit of their pet's problem is really important.
And I
Yeah,
think
I think
that's an
too.
important
Oh, go ahead.
an important aspect of the conversation is what what the owner's goals are when we start a treatment, in order to figure out how risk averse they are and how much maybe they want to push things, because there are some options that can be riskier, but there's a lot that we can do to mitigate those risks,
Mhm.
but just trying to make sure that we're all on the same page with our goals.
I was just going to say that I think too that people don't often think about the fact that in a human who's diagnosed with cancer, number one, of course, they're always trying to go for an absolute cure when they can obtain that, right? And the time frame is way different, right? So if a 50-year-old person is diagnosed with cancer, they want to achieve 30, 40 more years of their
50.
life, right?
Yeah.
50 years, 50 to 60 years. But if a pet is 12 and is diagnosed with cancer, we're hoping that they can achieve maybe, a few years, right? Because even their natural lifespan is shorter. So it doesn't have to be as aggressive, I think. And you can't tell this pet, okay, you're going to be really miserable for 6 months, but then you're going to live a normal lifespan because you can't, right? So
Right.
we definitely kind of accept different side effects in pets.
Yeah, I think that's a common scenario that we do try to manage, are those considerations related to quality of life. If I were to think of an example like a pet that comes in with a nasal tumor and is having sneezing and bleeding from the nose all the time and congested breathing, like they're having a lot of symptoms that are
Right.
impacting their quality of life. And we have to make a decision, and that decision could be based on the pet's age, the extent of their disease, and their prognosis. But it's how aggressive do we really want to be with respect to their therapy, because we can push harder and we can improve that average duration of tumor control, from a shorter amount of time to a longer amount of time. But there is additional risk, typically more side effects, potentially more costs that go along with some of those more aggressive therapies. And so we have to kind of find that right balance of an owner's goals and priorities as we pick the best therapy for them and their family.
And one of the things I've noticed sort of as I've been practicing now for the past like 13, almost 14 years is that, the level of diagnostic ability that you guys have as oncologists has really shifted or changed. I mean, even drastically, I would say in the past few years, right? Meaning that, the type of way that we help diagnose these patients or the way that we are diagnosing these patients, there's all these like special stains and different types of markers that we can look for. Would you sort of say that over your course of practicing that you're seeing a dramatic shift, in the abilities that we have as practitioners for these patients?
Yeah, absolutely. I mean, I also am out from vet school about 15 years, and I don't even think we learned about subtypes of lymphoma. So we just,
Right.
B and T cell lymphoma, which are two really, really common subtypes. And now not only we have upwards of probably 2 dozen subtypes of lymphoma. So we went from none to, I think we're actually probably closer to 3 dozen. And in people, I think there are 50 or 60 subtypes they
Wow.
recognize. So there's a lot more we can do because we know now that those behave differently. And if we can figure out the subtype, but we've got to run some additional tests. So that's an important part of the conversation. But if we can figure out these subtypes, some of these cancers are very aggressive, and these dogs are going to live out their normal life almost no matter what we do, and trying to get that answer. So there are a lot more tests that we can run now. Absolutely, there's a lot more cellular markers, the special stains or immunohistochemistry, and we're starting to do more genetic tests, but that's still really in its infancy for
Wow, that's
veterinary
cool.
medicine.
Yeah, I used to think about the fact that the most common skin tumor that we see in dogs are mast cell tumors. And mast cell tumors have a notoriously wide range of behaviors, from being these little tiny spots that can just sit there for years and do nothing, to frankly being some of the most aggressive, fast
Yes.
growing, inflamed, and metastatic tumors that we can see. And I used to joke, I guess I still do, that, one day I'm probably going to retire from veterinary medicine and we may still not know how to treat a mast cell tumor because they're just so difficult to predict
Yes.
which ones are going to be the really bad ones and which ones are going to be the really good ones. But we do now have a number of molecular and immunohistochemical tests that help us to do a better job of predicting whether this mast cell tumor is one that requires more aggressive therapy, because it is going to be a nastier one.
So if all this discussion didn't tell people why we should refer to oncologists, so why would a client who's listening to this, has been diagnosed with cancer, tell us why you want them to go to you as opposed to stay with me? And I know the answer because you're not staying with me. But tell us about referrals.
I'll go first. I think that it's certainly true that oncologists have the most experience and expertise managing and communicating about all of the options related to the treatment of their pet. So that's really probably the most important reason. It is also true that when it comes to treatments like chemotherapy, safe administration of chemotherapy is not easy and requires a
Yes.
significant amount of both medical and technical expertise to do well. And the fact that once you start a course of chemotherapy, there are hundreds of little decisions that need to be made related to: how is this pet doing? Is this the right dose and the right drug, or do we need to make changes? And that does require a lot of experience to really have a good feel for. And then I have the easy answer with my job with radiation therapy, is that the equipment is so complex and expensive that it only exists at a few specialty facilities that typically have radiation oncologists. And so for that type of treatment, it requires a referral to someone that can do it.
And I like what Ira said, but I would also add sort of the softer aspect of it, which is I kind of see my job as offering hope. I think a lot of people come in to see us and they're really downtrodden. They've just gotten a cancer diagnosis.
Right.
And, in the vast, vast majority of situations, we have a lot of options that we can offer to make that pet feel better, to make that pet often live longer, depending again on their goals. And that was a real shift for me starting out in emergency medicine, where I was first practicing, and kind of coming into oncology sort of slowly by helping out our oncology department where I used to work, and just seeing the optimism and the ability to offer hope. A lot of people feel like oncology must be a really depressing specialty, but it's really not. I mean, I just have people every day who come in, really sad, really worried, and then they leave with hope. And that's what we hope to offer them.
Oh, that's
Well,
awesome.
well said, Dr. Stewart. I think, as most veterinarians do, I really view our job as being one of an educator, to people and families. And I can't even begin to count how many pet owners that I've seen that at the end of a conversation about their pet may end up deciding not to pursue some of these therapies, and will say something like, I almost didn't come in here because I didn't really think that I wanted to do these things, but I'm so glad that I did. I have a better understanding of what's going on with my pet. I know that I've explored all of the options and understand the pros and cons, and now I'm making this decision in an informed way as opposed to a reactive way.
Yes.
Mhm.
That's what I think. I mean, honestly, and this goes with any specialty. When they come in through the general practice, if there is something that we can sort of hang our hat on, if they have a neurologic abnormality or there's a fear of cancer, having them speak to that specialist, really, it's not that much of a commitment in the grand scheme, but being able to have sort of all of those options, the discussion with somebody that manages this on a regular basis is so important. And it honestly makes the regular vet feel better too, knowing that that client is going there and getting all of the information, because there are a lot of changes that are going on, in research and, treatments, and that being able to have somebody on the cutting edge, I think, is so important as far as, the care for their pet.
Well,
Yeah,
it's
this is one
scary.
specialty where you can't there's many specialties that overlap very significantly with general practice, right? So like a skilled general practitioner who's really good at surgery can do a lot of surgeries that a surgeon could do, albeit there's a different level of training there. there are a lot of skilled general practitioners that can manage a complicated diabetic or a cushingoid or these things that we often send to internal medicine. But like oncology has so much knowledge that you need of all of these different tumor types, different markers, different options, different chemotherapeutics. It's so specialized that like having that as an available option to send clients to is really irreplaceable. And so, my few clients that say, "Well, can't you do this?" No, no, I cannot. Definitely I cannot. I don't know anything that these oncologists know to that level for sure.
I think it's really scary for pet owners when this is their first time that they've had a pet with a diagnosis like this, and potentially their general practitioner has some experience, but it's, I think, really reassuring to see somebody that can say, yeah, I have seen this many, many times, and I have an awareness of the studies that are out there regarding this problem, and I can tell you about what there is for your pet, that can alleviate a lot of those initial uncertainties and fears.
Mhm.
It's awesome.
You have a whole spectrum of trained staff as well. So do you want to speak to, what in oncology, you have oncology techs that are specific to oncology. And so what do they do for you as a practitioner?
Everything.
I knew
Excellent.
you were going to say that.
No, our technicians are amazing. I mean, technically, they develop these skills that are truly unique, even skills that are thought to be sort of routine technical skills, like placing a catheter, are totally different when it comes to chemotherapy. There's different requirements, and frankly, it's a much sort of higher stakes activity with chemotherapy, because if even some of a drug gets outside of a vein, that can impact the effectiveness of that treatment, or in some cases could actually lead to very, very serious complications. And so they have to be very, very skilled and know how to do that well. And in radiation, of course, the running of a machine is very technical, but we also do a lot of anesthesia. People don't
Mm.
always think about this, but when people get radiation therapy, they put you in a device and stay perfectly still. We're all stepping outside and closing these lead doors while the treatment goes on. But for pets, we can't do that. We have to put them under anesthesia for that. And we often have to do that every single day during a course of treatment. But they are brief anesthesias and not stimulating or painful procedures. And so we have a team that sort of learns about how to do anesthesia in a way that can allow pets to, go to sleep, wake up quickly, and not have after effects that are going to last the rest of the day or into the next day when they're coming back in for treatment. And those are important, but really our techs are most awesome about communicating with our pet owners to address their concerns, answer their questions, and provide the support they need. And that's what I appreciate them the most for.
Yeah, in a lot of ways, we were just talking about this. Our techs almost serve a role that's more becoming more akin to like a PA in humans. They do so much for us. I think we could not see even half the caseload that we do see if I didn't have technicians that were comfortable and had an understanding of the disease process, how the chemotherapy works, the side effects, basic blood work changes. I mean, they really do field a lot for us. And all of our technicians have at least 2 years of college training. Some have done additional training. We have a couple technicians right now working on what's called their VTS specialty in
Awesome.
oncology, which is even a higher level of training. So, sometimes I think we think of a technician as somebody who's maybe cleaning kennels, but that's a very, very different role. And these guys are really highly trained, highly knowledgeable, highly resourceful individuals.
That's awesome.
Yeah, definitely. My recollection of actually way back in vet school was that, the technicians actually really ran the department and could like, push the doctors, go do this, you go do this. I'm going to give this pet its, prescribed chemo. And I assume you run that sort of in a similar way where you can prescribe your course of your drugs or, and then they can come in and have the technicians manage most of that appointment to actually administer the drugs, depending, of course, on the drug.
Yeah, I'm sure my techs would tell you that Dr. Gordon wouldn't even be able to tie his shoe without them to help me. So they certainly really keep us on track. They organize our day, and they truly are the ones taking care of the patients in oncology much more so than the doctors.
That's awesome. Do you guys, do you have and this is putting you guys on the spot, do you have a specific like case, or can you remember like a really positive, you know, oncology case that you had that, you'd want to share with listeners? Like, meaning somebody came in with a dog maybe that was in a bad state, or, treatment seemed to work, or anything that was sort of a good highlighted case in your career.
We have a
Lots.
case that we've worked on together for
Oh,
a lot
cool.
of years. A dog named Vixen. Um, and Vixen came in initially to see me because she had an anal gland tumor. This is about 5 years ago. And we had done an initial staging workup, as we talked about before, to look for where the disease was. And it was confined to the anal gland at that time. But that's a tumor that does have a high risk of spreading to other places in the body. And so the first step for Vixen was to send her to a surgeon to remove the primary tumor. We talked about doing radiation therapy to sterilize the cells that they can't get out that are just right next to the rectal wall, typically after that surgery, and or chemotherapy because of this risk of spreading to other places. And the owner initially was really sort of concerned about radiation side effects because we can see some significant ones in that area, and so decided to do chemotherapy and monitor at that time. Did really well through chemotherapy. I think the only thing that went wrong was she lost some of her whiskers. She's a husky dog, and some of her
Oh,
whiskers fell out. And but never really, was sick. Never had nausea, diarrhea, any of those signs. And a couple years later, did start to develop an enlarged lymph node in the back of the abdomen that was from spread of the tumor. They switched over to some different chemotherapy drugs, which she tolerated well, but it kind of continued to grow slowly. And ultimately, we decided that radiation therapy would be the best way to try to slow the growth of that lymph node. So she went through a course of that, and we did a course of radiation therapy that was not our most aggressive course, but one that is shown to significantly delay progression of that stage of anal gland disease. And again, had no side effects. We do worry dogs can sometimes get temporary diarrhea when we do radiation therapy right next to the colon where those lymph nodes live, but didn't have any of that. And then has continued on, got some additional chemotherapy, is now I think close to 5 years out from this initial
Wow.
diagnosis. She's needed a lot of therapy to sort of get to that point for sure. But I kind of laugh when I say, the worst side effect she had in 5 years of all these different therapies was when she lost those whiskers at the beginning of chemotherapy.
did she bump into things because of those whiskers
No, I
lost?
don't think so. She adjusted pretty well, and she's just been a wonderful dog, wonderful family, and been a great case.
That's awesome, because both of you guys were involved too. That's great. I like that. The medical oncology side and the radiation oncology side. It's cool. I think it's funny that you had mentioned, that you guys are doing a little bit more of the diagnostics on your side this time around. And I do think that that has shifted since COVID for sure. I mean, I remember early on in my career, really trying to get all of the ducks in the row before they would ever go to oncology, like getting that, doing the staining, even like that the, different labs would recommend, and the chest x-rays before they actually sent to oncology. But you're right, we are just inundated with cases that it's funny that you guys are also feeling that pinch of just sort of the case volume has gone up significantly since COVID.
Yeah, I mean, we definitely are seeing more consistent cases. So usually we can kind of map where we tend to have a slowdown each year. And since March definitely was slower, nobody knew what to expect. But really, since April of 2020, we have not had a single slowdown. And what's amazing is how many clients I have seen in the last year who bring a pet in they have just adopted, and
Yeah.
then they find out it has cancer, and what just a tribute to their dedication to this pet they've just adopted to be coming in and seeing us and pursuing some options. And it's been really amazing.
Yeah, I'm surprised. I don't know. I still don't know why our lives are the way that they are right now as veterinarians. I know that a lot of it is just the increase in pet ownership during COVID. I was reading an article today that was written by what came through the Associated Press about vets and how we're kind of struggling. And I guess some owners who might have decided to euthanize their pets throughout this year kind of have not, and maybe have sought out additional therapies for their pets because they're kind of helping them to get through the pandemic stuff. Like, it's so fascinating. And then you're sitting here at home working and notice that your pet has this little lump, and normally you would have just like blown it off for 6 months. And now you're like, I got to call the vet. So it's like all of these factors perhaps it's good for our pets, relating back to your field. Maybe more pets are getting the oncology therapy that they actually need as opposed to not, because people have time to do it. I don't know. I don't know that they have more money to do it right now, but yeah.
I do think that people spending all this additional time at home and around their pets all the time has just increased the closeness of the human animal bond in many of these cases. And I think that's a big part of why anybody would pursue something like cancer therapy for their pet. There's, if you were to just look at it from a strictly you know um, sort of objective or sort of dollars and cents, how can we get the best you know benefit for the medicine that we give to our pet, rather relative to the amount of sort of life expectancy it might give them, like, or how replaceable is a pet, might be a better way to sort of think about that. Like, yeah, like there's not there really has to be a bond that makes that pet a member of the family to view them as irreplaceable, essentially, to want to do it. And so we appreciate the opportunity to be part of that team that allows people that are so close with their pets to do that.
Oh, that's awesome. Well, you
Absolutely.
guys, we can't thank you enough. We just want to thank Dr. Gordon and Dr. Stewart from the Oncology Service. The Oncology Service does have 3 locations in Virginia, Leesburg, Richmond, and Springfield. And you can follow them on Facebook at The Oncology Service, and on Instagram, YouTube, Twitter at Ethos of Veterinary Health. And you can learn more about oncology and TOS, which is the Oncology Service, hospital locations at ethosvet.com.
Great.
All right. Hi, everyone. Next, we are starting a new segment with our colleague, Dr. Chris Thompson from VHS North County in California. Chris will join us to give us new insight into his work and clinical trials throughout Ethos organization and with our nonprofit Ethos Discovery. So welcome, Chris. How are you doing out there?
Good. How are you guys doing? I heard you had both medoncs and radoncs on the last kind of segment of this. So glad to represent surgical oncology as well.
Absolutely. It's
Yeah, it
all
was
part of
cool.
the plan. It's Lon's master plan to take over the world.
Right.
So tell us about any new advances or continued work in surgical oncology, and what have you been up to?
Yeah, so everything seems to be going well, same as what I'm sure they told you. We are staying busy as ever, which is always good. We do have some pretty exciting things coming up the pipes from Ethos Discovery, meaning that still continuing with our projects like we talked about before, specifically the ePush project for hemangiosarcoma. Just found out that we are now just starting our enrollment for a new clinical trial here at VSH North County that is specifically using a minimally invasive surgical technique for removal of lung metastases or
Oh, wow.
spread of cancer from the
Wow.
lungs. So a lot of exciting things coming up, and we'll be hopefully posting some blog posts to the Discovery website soon for that as well.
And so, for some of our listeners, often when we have a diagnosis of cancer, we're talking or discussing going to surgery. One of the things that we'll do beforehand is take these, chest x rays or x
Mhm.
rays basically of their lungs to see if cancer has spread to that area. And if there is metastasis or what you sort of had just discussed, then that's sort of honestly an end game. So, this may sort of revolutionize that if there's a treatment to sort of help correct some of those metastases in the lungs.
Yeah, I think it's really interesting, and it's an exciting area to be working in, just because for so long, particularly in veterinary medicine, anytime we heard or saw of spread of cancer or the development of metastasis, it always seemed to carry such a poor prognosis and poor connotation as to that's it for that patient.
Right.
And on the human side, the trend has definitely changed from seeing metastasis as something that is condemning that patient to actually, this is something that you can still live with, meaning that even if a patient has metastasis and they don't jump to surgery, there's still so many things that we can do from, again, the surgical oncology side, the medical oncology side, the radiation oncology side, because it's really important for us to kind of reframe the conversation away from, this is advanced, we shouldn't necessarily do anything, to really, what can we do for this pet to maintain the absolute best quality of life while they're living with cancer? Because again, it doesn't necessarily matter what you die with, it matters what you die from. And so if we can really continue to maintain their great quality of life while treating these cancers in a variety of ways, I think that, again, that conversation can be a little bit different, meaning that the development of metastasis is not necessarily something that stops the conversation. It really continues to evolve as we treat those patients.
So tell us about that trial. What is it? What is there a particular type of metastasis that you're working with as in the clinical trial? Is it
Yeah.
all metastasis to the lungs
Yeah,
or?
yeah, good question. So the early phase of the trial is for a wide variety of different dogs with metastasis. Our main focus is for dogs with osteosarcoma,
Mhm.
and the reason for that is on the both in the dog and human disease and the data that we have, there's a very surprising benefit of surgical resection of lung metastases if it's possible, meaning that where it's feasible to remove those nodules in the patients, if they've already undergone surgery or potentially chemo for the primary disease, there's actually a massive survival benefit for those patients. One of the reasons it has historically not been commonly performed is because surgery of the lungs or thoracic surgery is always associated with a concern for high morbidity or high pain and prolonged recovery. And now we have technologies with minimally invasive surgery where I can actually go in and remove those nodules with very tiny incisions smaller than your index finger to get those nodules out. And so those patients are acting like nothing happened within hours after a surgery like that. So if we have this ability to do this in a very minimally invasive, non-painful manner, have the potential to give them a very good outcome and quality of life, then I think that's really where we need to be pushing the science.
And are you diagnosing the metastatic disease via like a CT scan? Are you waiting for radiographic appearance
Yeah.
of them?
So most of them are initially diagnosed with radiographs. For the clinical trial, we are doing CT scans on them just because it really helps to further define exactly where the nodules are, their size, their relationship to other tissues and anatomy within the thorax. And so they're often initially diagnosed with radiographs and often from the family veterinarians. And then from there, we'll go on to the advanced imaging with the CT scan.
Excellent. And do you have I'm obviously fascinated by this
Yeah, well,
study.
it's
Yeah.
it's gonna change. I mean,
Yeah.
this could absolutely change the way that we practice medicine. This is extremely exciting.
So is it like, do you have a maximum number of mets that you would go in and retrieve on a particular patient? Is there a minimum size or a maximum size that you would go after?
Yeah, so that's some of the things that we're still figuring out, and
Studying, yeah.
most of that has to do with the amount of lung that we would have to resect with the tissues. So it's really on a case-by-case basis, meaning that we are assessing the disease burden, meaning how many nodules, how many evidence of spread there are within the lungs off of that CT scan. And then if we're able to go forward with surgery, while still maintaining an appropriate or adequate amount of remaining lung volume, then that candidate will qualify for the study. And so that is really based off the CT scan and one of the goals of the CT scans prior to jumping into surgery. If a tumor is bigger than 5 centimeters within the lungs, then they don't qualify just because those patients would not be able to have the minimally invasive option for surgery. So there's a little bit of a size limitation, but it's really on a case-by-case basis.
And how long do you expect these trials to go on? Like, do you guys have a kind of a game plan of how it's gonna look?
Yeah, we always have a game plan and a expectation as to when we expect to start enrollment, when we expect to finish, and honestly, it's always kind of over and under for most of those cases. For this particular clinical trial, we're starting with 18 dogs, and so we are hopeful that we will get those 18 dogs in about a year and a half. But you never know, and it's always hard because the enrollment may take more time than we expect. We may also get for some of the trials, we found that we plan that it'll happen within a year's time, and it happens within 4 months, just because there's so much excitement around the clinical trial. So it's pretty variable based off of the recruitment of cases.
That's awesome. Well,
Do you
very
have any
exciting.
other things you're working on that you are excited to discuss, or is that I mean, that's enough, by
That's
the
a
way.
pretty big thing. Yeah.
Yeah, I think that's the big thing, at least
Yeah.
for my side of things. That Discovery is starting to roll out a handful of additional new trials in the coming months, and so one thing I would emphasize, especially for any veterinarians that are listening, if you want to be interested and want to refer patients for this, it's very valuable just to check out our website. It's constantly changing and evolving with what trials are open and where those trials are open, just because we have a lot of things that are definitely in development, and what's posted is really the tip of the iceberg. And so as those trials come to fruition, they generally first get advertised on the website.
Awesome.
Great. Great. Well, thank you so much for jumping on again to give us
Yeah.
little updates. I think it's really great,
Yeah.
especially with how your field really kind of touches upon most of the topics that we do in these podcasts.
Yeah, I'd love to hear all the discussions about the oncology general team before. It's really great. Again, I think that the more we can get all of the specialties working together to maximize the benefit to the patient, the better. And so it's really great to hear about, again, the med-onc and the rad-onc side of things.
Yeah.
Thank you to our sponsor, Ethos Veterinary Health. Don't forget to rate, review, and subscribe to us on your favorite podcast platform. We also have a video version available on YouTube where you can find us at Ethos Veterinary Health.
And for updates on clinical trials at Ethos, follow us on Facebook or on our Ethos Veterinary Health and Ethos Discovery pages. Thank you so much, Dr. Thompson. Appreciate you guys coming in.
Yeah, it's good to see you guys.
All right. We'll see you guys all next time. I'm Lindsay Renzullo.
I'm Krista Vernaleken. Bye.
Bye.